Rock Hotel and Casino Atlantic City Studios, high atop Madison Square Garden.
Good evening. This is Bill Ayers on 95.5 PLJ. Hope you had a good weekend. Sort of a mixed weather weekend, but we're going to talk tonight about the difficult topic, depression tonight, high-functioning depression. Do you or anyone that you know have what's called high-functioning depression? And our guest tonight is Dr. Collen Cira. She is a clinical psychologist, and she is the executive director of the Cira Center for Behavioral Health out in Chicago. She deals with trauma and anxiety and all kinds of things. Welcome, Doctor.
Thank you so much for having me, Bill.
Good. Tell us a little bit about this. I mean, we all know about anxiety. And by the way, folks, if you want to call and get to talk with Dr. Cira, give us a call at 1-800-321-9755, 321-9755. If you or anyone that you know is suffering from depression and you're still functioning, but it's bothering you, well, give us a call. So tell us a little bit about your work and what you mean by high-functioning depression.
Yeah, I can definitely start there. So we specialize in trauma, but a lot of people don't call in because they identify as a trauma survivor. They're calling in for all the things you would typically think of, depression, anxiety, struggling in a relationship or a job, things like that. And so the majority of the people that we work with have some depressive symptoms, if not meet full criteria for depressive disorder. So this is something we do all the time. Technically speaking, major depressive disorder, in order to meet criteria for major depressive disorder, you have to be not functioning. Okay. So for that particular diagnosis, it requires that a lot of areas of your life where you would typically be functioning that you're not able to. So in that specific way, it's high functioning depression isn't really a thing. And yet what we know is that so many people do struggle with depressive symptoms, and because they're not able to stop functioning or they are able to keep going in some ways, it is a real thing.
Okay, so people are functioning in this category that you're talking about, and you see them. So they may be the person that you work with, they may be the person that you know, that's your friend, maybe somebody that's in your family, and you kind of wonder about it because they're not happy, and they seem to not be enjoying life, but they go on with life. And they make decisions and they do things, and but their life isn't so good. So that now we're not just talking about an occasional sadness. We're talking about something that's kind of always with somebody. Why don't you describe that for us?
Yeah, so I think that can be a lot of different things. Sometimes people have an expectation that when they lose someone, when somebody dies or there's a breakup or an ending of a relationship, that they should be getting over that quickly. But a lot of times that sadness can exist for people for long periods of time. Some people's temperament skews them more to be more sad. Sometimes there is a situational event that's not a loss, but a change or even a stressor, even if it can be good. But that kind of change or stressor can make people have a low mood for a longer period of time. So there are so many reasons that people might experience depressive symptoms and still be able to function.
Okay. So if you would like to talk with Dr. Cira, give us a call at 1-800-321-9755, 321-9755. Maybe it's you, or maybe it's somebody that you know who you think is depressed and you'd like to help them, or you'd like to get some help yourself on how to deal with this. And it's not so bad that you can't function, but it's bad enough so that it's affecting your life. Give us a call at 1-800-321-9755. And at 1 o'clock, as usual, we have our Community Connection show. We have a wonderful guest tonight. She's a sister. Her name is Sister Caroline Tweedy, and she's the executive director of the St. John's Bread and Life organization in Bed-Stuy. And they are a very large organization, deal with thousands of people. And one of the things I like about them is that they don't just give people food. First of all, they give people very nutritious food, but then they also try to ask the why questions and help them get out of poverty. They have a lot of services she will tell you about. She's terrific. And we'll talk to her at 1 o'clock. But right now, you can give us a call at 1-800-321-9755 and talk to Dr. Cira. Say a little bit more about the work you do and how you help people to get out of this or deal better with the depression.
Yeah, I think there's a couple of things that we do and lots of people do to help folks who struggle with depression. What we know through a lot of research is that a combination of therapy plus medication is often the best way to get people feeling better quickly. So we know that's the truth. But we're also learning through new research is that mindfulness and meditation is very, very powerful. Sometimes it's been proven that it can be just as equally, if not more powerful than medication alone. So mindfulness and meditation should absolutely be a part of the treatment when we're working with depression. And because I specialize in trauma, I'm a little bit biased in this regard. But I think that we also need to be trying to find the origins of the symptoms. Perhaps there was something in somebody's life. There was a breakup. There was a big move. Perhaps there is some very identifiable thing in the present context that helps us understand why somebody's struggling. But I'm always curious about what happened before, what happened in people's past. What were people's early lives like, early relationships? Those things are tremendously important in terms of laying a foundation for us. And if that foundation was cracked for any reason, it can make us vulnerable to things like depression and anxiety, PTSD. And so I'm always curious about what the origin of people's symptoms are, because if we're just constantly treating the symptoms, it feels like a bit of a Band-Aid to me. Does that make sense?
Oh, it certainly makes a lot of sense. And I've had thousands of people over the years who've called who've been in a situation like that. And that's why I wanted you to come on the show and talk about this. So let's say a little bit more about mindfulness and how you put the package together to help people. You try to get to the root cause of it, first of all. And then as you have a dialogue with people over a period of time, you can get a sense of where you think they need to go.
Yes, absolutely. So the first thing we would typically do in therapy is get people feeling better. So we are talking about some Band-Aid solutions. I feel strange even saying, referring to mindfulness or meditation as a Band-Aid solution, because it's absolutely not. But what I mean when I say Band-Aid solution is that it's a quick way to address symptoms and reduce symptoms. And for somebody who's practicing even just 5 minutes of mindfulness or meditation a day, what they will see after a number of weeks is that their baseline levels of depression or anxiety should start to go down. And so that is very, very helpful. So that can be doing anything and you're just really noticing it. That's more mindfulness. When you're walking around, you're noticing the clouds, the sun, the wind, the smells, sounds of birds. Mindfulness is being grounded to the present moment.
That's a key thing, being grounded to the present moment. And I would think that, say, a walk in nature or even just looking out the window can be helpful to you because it gets you out of yourself.
Absolutely. The problem is in our heads. We spend too much time in our heads and acting and thinking as though our thoughts are the truth and we have no control over our thoughts. And for many of us, that feels like the reality. But there's lots and lots of things that we can do to take back that control. And a huge part of that is being grounded in the present moment. You're absolutely right.
Number to call, 1-800-321-9755. Let's talk to William. William, this is Bill Ayers. You're on 95.5 PLJ.
Yes, hello. How are you?
Go ahead. You're on.
Thank you. Yes, I was listening to the doctor and what you were saying also, and I definitely feel like, yes, I have, I go through my day, but some days are good, some days are bad. I just feel like I've lived with it. I've lived with the feeling of just, I guess, being depressed and what have you. but it never went away, and it's like part of my daily life, and I can definitely tell like it's just not getting better, and it just have lost more interest in many things, like just like going to the gym, or it has affected my relationship with my girlfriend, or even with family members.
Sure.
So
are you able to work, William?
So with the work, it's interesting. Like when I'm working and all that, it's no problem. But
Okay.
But it gets to the point where I just start getting depressed, and so it's like it starts working against me. And so, but it's just the motivation of a lot of things, just like the basic things, But I mean, I will never walk away from taking a shower or something like that. But I'm talking about like more, like just looking out for yourself, like going out, let's just do a walk. So things that I used to have a huge interest on, they're no longer there. So
right.
I'm wondering what is the best way to go about that, and like I wouldn't want to take any prescription drugs for that, and if there's a natural way about it, or just talking about it, but kind of like have some light.
Let the doctor talk to you about that.
Yeah, absolutely. First of all, I'm so sorry you're going through this, and I'm really glad that you called in and are still trying to figure it out after all this time. That's in and of itself is really impressive. I've got a couple of thoughts. My first is, it may sound obvious, but have you ever tried therapy?
Right. So I've always been, I guess, concerned that the therapy might lead into just maybe medication, and
I see.
Go ahead.
And you don't want to do that.
Right, but that's the thing. I don't want to feel groggy, or I don't want to feel like just sleepy or something like that. Like I don't go through anger issues or not. But I definitely, it's just, I guess, the motivation, and I also have like that lack of just interest. And when I see that it's affecting work and relationship with your family and girlfriend, like I know it gets to a point where I'll also anything just makes me like sad, like just super sad. So it's like wondering to what point I should like address this and deal with this head on, because my health insurance is also through Medicaid, so I don't know if there's help through that, or there's like people that do this pro bono, or that kind of thing.
Okay. Absolutely. So here's a couple important things to note. I think there's a lot of confusion between the difference between psychiatry and psychology, or between a psychiatrist and a psychologist. Psychologists or master's level therapists, LCSWs, social workers, all therapists, for the most part, can't do anything with medication. We've got some of that changing now, but for the most part, as a good general rule of thumb, therapists do not do medication. So while a therapist might encourage you after a full assessment and they thought that was your best option, somebody may encourage you, but nobody is going to force a prescription on you. No one is going to mandate it. You'd have to see a psychiatrist for that. So I think therapy is a great place to start. And I understand the concern with Medicaid, but there are folks who take Medicaid, and there are folks that do this at a reduced rate or a pro bono rate. So psychologytoday.com is a fantastic website where you can search based on, it's kind of like Match.com, only for therapists and clients. You can search on a number of factors, and then people's profiles, therapist profiles come up, and you get a real sense for who they are and what they're like. And you can search based on insurance and who accepts your insurance, or who is willing to do therapy at a reduced rate. So I think that is the place to start.
That's a great suggestion. Do you get that, William? In other words, what the doctor is saying here is you don't need to necessarily have medication. And in fact, if you go to see a psychologist, they can't give you medication. They may recommend that you get it from somebody else, but they can't give it to you. So,
right, of course.
So you see the difference there, right?
I understand, definitely. Yeah, and I understand now that therapy could help, but it's always been my concern. Like if it's something that will go away, but then again, it's like the definition of insane. You know, like you're doing the same thing, expecting a different outcome, and I don't want it. And it's not happening, and it's getting to the point where it's affecting also work, and I don't feel like that drive that I used to have, and especially like even working out and I think it depletes you from just enjoying what is around you, and it's life really.
Say a little bit about when this started and whether you think you've always been this way.
I think it started. I guess it started when I would actually have like any type of issues, you name it. Just basically, I moved from South America to New York many years ago, and just that feeling of nostalgia and just feeling nostalgic and just missing friends and what have you, and then poor choices that I made. For example, like I came out of high school and I just went straight to work, and I didn't go automatically went into school. And so that led to some other issues, like basically when I was getting jobs, so I was getting, jobs that I didn't necessarily was happy about in retail and what have you. Doesn't matter, but it was just jobs that I was not proud of. So as time has gone on, I'm carrying on those bad decisions, and that actually leads to me to feeling bad. But now the depression has caught up with me to the point where I just don't know what to do and how to just manage my own stuff.
Okay, let the doctor give you some more clues.
Okay.
I mean, I think that reaching out and getting some help is the most important thing. It's the thing I cannot stress enough. You've been trying to manage this on your own for years now, and like you said, it's what you're trying, and your efforts are fantastic. But sometimes we just need some extra support. So I know that there's a stigma with mental health. I know that stigma can be even worse in other cultures and different communities. But I think the most important thing is to reach out for help. However, there are some other things for you to try. What we know is that depression makes us want to isolate. It makes us want to, like you said, that you're backing away from friends. You don't have that motivation, the energy. It makes us kind of want to isolate, withdraw, hibernate a little. So the more active, the more social you can be, even if you feel like you're forcing it, the body winds up kind of just going along with it once you're doing it. It's the whole fake it till you make it thing a little bit. You're doing a lot of that already because you're going to work every single day. But sometimes when you've got the energy or the motivation, it can be really helpful just to take a walk around the block rather than sitting and watching TV, which is what's so easy to do when we're feeling terrible. Have you tried any of that stuff?
Well, I think we may have lost William there, but I hope he heard what you were saying, and he can call us back if he got disconnected. But I hope everybody can hear that the two really important clues that Dr. Cira has mentioned so far, first of all, being willing to get some help, and number two, doing some things that can help yourself. So we'll continue that conversation and talk about it some more. We want you to be part of the conversation. Give us a call at 1-800-321-9755, 321-9755. We had another person call before, and he can call back as well and talk to Dr. Cira. The kinds of people that you see, they're people who are in various stages of depression. And you've mentioned two clues so far, very important ones. Obviously, the first one is getting some help to talk to someone. And then the other one is mindfulness and meditation and socialization. Say a little bit more about how that can help people.
Sure. So we talked a little bit about the mindfulness, using your senses to be grounded in the present moment. Meditation is similar, but just different modalities. Instead of using all five of your senses to be really present, you're going to kind of focus in on one thing with meditation. So for some, that's focusing on your breath. For some, that's the rise and fall of your belly. For others, that can be a mantra or a phrase that you're going to focus on and repeat. But it's getting more connected to your body so that your head and your thoughts quiet a little bit, which is actually kind of, I shouldn't say that because it's not that your head naturally quiets. It's that you get better at controlling what you're shining your light on and what you're focusing on. So that's meditation. And then the getting out, the being active, the being social, like I was trying to tell William, depression wants us to hibernate, to isolate. And so the best way that we know is something called behavioral activation. And it's just getting up and getting moving. It's talking to people. It's kind of fighting the instinct. Because the instinct when you're depressed is to shut down. So if you can fight that through your behavior, your feelings eventually catch up. But that can be really, really hard to do when you're struggling with more severe depression.
All right, number to call, 1-800-321-9755. We're going to talk to Nick. Nick, this is Bill Ayers. You're on 95.5 PLJ.
Hi, how are you?
Okay.
Yeah, I'm calling. I have a relative of mine, a cousin, recently lost her mom. Very difficult person to reach. She basically shut herself down. The only thing she talks about is just her mom. Gets off from work, goes to the cemetery, stays there for a few hours.
Oh, boy.
During her lunch break, comes back home, and basically that's all she does. She doesn't have any other communication. I mean, she has family members, she has sisters, she has a brother, but it's very hard for her to overcome the loss of her mom.
Yeah. She lived with her mom for many years, I take it?
Yes, they basically lived in the same house. You know, when her mom became ill, she basically the caregiver. She would take care of her, but she did have her siblings that helped as much as they could. But again, she was there the whole time, and she saw how her mom got from being a functioning human being to someone who basically didn't have any function at all.
How old was her mom when she died?
I have to say she was 81, possibly.
Okay. So this woman is, I take it, not married, and she's single, and she's probably 50?
She is married.
Oh, she is.
She doesn't have any kids of her own, but she is married.
And how does her husband deal with this, and does she talk with him about it?
Again, it's just very, I don't want to say secretive, but very, it's just between them. They don't really talk about their own business we don't want to pry. We do talk to her, say, that it's difficult. We understand how difficult it is. We all have lost loved ones, that we have a hard time dealing with losing loved ones, but I guess, as they say, time heals wounds. She doesn't want to hear that. She actually gets upset when you say that to her. So you're kind of like not sure what to do. You want to help her because she's family and you want to help, but again,
it's hard.
Well,
let Dr. Cira give you some clues on this.
How long ago did her mom die?
It's about 8 months now.
8 months. Okay. So this is really, really common. When we see somebody that we love struggling, it makes us very uncomfortable. It's the whole reason why newborns sound so awful when they cry or scream. We are biologically driven to help people, to try to make it better when someone we love is uncomfortable or in pain or in distress. But when we're trying to make somebody feel better, we often say things that can be minimizing or trivializing their feelings. Has anybody just sat with her and listened? Instead of offering advice or kind of encouraging her to move on, I wonder if you guys could sit with her and just listen to her stories or or sit with her when she cries. Does that sound really uncomfortable?
No, it doesn't. I mean, we've had, we visit, we go see her, and for the most part, she'll have just a casual conversation, and we ask how you feeling, how you doing, and again, she'll just basically talk about her mom, how miserable she is that her mom is no longer with her. Did I do the right thing to keep her comfortable?
Ah, that may be a clue here. Do you think there's some guilt involved here, Nick?
Yeah, I believe so. There is guilt, and knowing how she was, and we tell her there's nothing for you to feel guilty about, because whatever means you had available to you, you offered to your mom and to the whole family, basically, to her dad as well, to make sure that she was comfortable, the woman,
Sure.
They did everything they could possibly to help her. So again, I don't see anything that...
This is a sort of a common thing, right? When someone dies, especially for the caretaker, for the person who's been the major caretaker, right, Doctor?
Absolutely, yeah, so common, and grief doesn't have a timetable. What is really important is that when we are grieving, we let it happen. If we try to rush through the process or shove the feelings down, it just prolongs the whole thing. So the only way to get over it is to move through it. So it does sound like she is allowing herself to feel, but I hear your concern, which is that she's getting stuck in it potentially. Mm-hmm. I don't want you to reveal anything that feels uncomfortable, but I'm curious if she's always had a very close relationship with her mom, or if perhaps there was ever some less than positive stuff, or they really struggled at some point. Can you speak to that at all?
I don't really think they struggled too much. She did have a pretty close relationship with her mom. I think as her mom progressively became more ill, she drew closer to her mom, to help her, and she would spend days and practically nights with her mom, where she would avoid the relationship with her husband. Mm. So, I mean, some people are criticizing her about it. It's like, it's none of your business. That's her choice, and her husband is okay with her taking care of her mom. Then if that's what they're comfortable with, and the husband's okay with it, so be it. But it's been a struggle. I feel really bad for her. She doesn't want to seek any professional help. I even asked her, I said, what about even going to a priest or someone that you could speak with and just try to get this off your chest, and the guilt that you have, that you did everything possible for your mom, and but it's a little difficult.
I ask a question here, Nick. Do you get the sense that her mother was grateful for what she did, or do you think she got in the position of saying, well, you're not doing enough for me, or, you're not helping me? Was there any of that?
No, it was never like that. I mean, good. Unfortunately, with the disease that the mom had, she lost her sense of knowing.
I see.
Yeah, she had Alzheimer's, and it progressed so quickly that it was really difficult on everybody to see her like that.
Yeah.
So it sounds to me like you guys just need to love her.
And we're there, and sometimes we'll just go over and we'll just talk about happy things, but, whatever we could talk about. Mm-hmm. And again, she'll just come back, and whatever we talk about will always lead to her mom, and how sick her mom was, mm-hmm. and how she suffered, and how she misses her, and why does she have to go now, and so it's very upsetting to see her that way.
Sure. Have you talked with her husband about this?
Her husband is there. I mean, her husband has been very supportive. Mm-hmm. From when her mom was ill, that stayed throughout the whole duration with my cousin, and helping her and making her feel comfortable as well. But it's difficult. It's difficult to see.
Sure. You don't
her,
like
you
to
know,
see
being that-
somebody you care about suffer like that. Any other suggestions for
Absolutely.
Nick, Dr. Cira?
I don't really. This is the really tough thing about grief and bereavement. There is nothing to say. There is nothing to do, and that's what makes it so exceptionally painful for everybody, right?
Mm-hmm.
It's impossible for her because she lost this pillar in her life, and it's impossible for you guys because you hate seeing her in pain and you want her to feel better, and there's no way to help her get there. There is no way to help her get there. Bill, I think what you said is really true about you're just loving her at this point, and I know you already are.
Mm-hmm.
I know you are, and that's why you're calling, is because you love and you care about her so much. But I think the more that you guys can just sit with her and allow her to be sad and allow her to talk about these stories. You know, grief therapy, if she were to go to a professional and do grief work, really the majority of that would be letting her tell story after story after story while she bawled her eyes out. So if you guys can do that for her and not change the subject or not try to put, find the silver lining, which I know is really hard to do, that's the best thing you can do for her. But I say that knowing how incredibly difficult that is for everybody.
And lots of hugs.
Yes, I mean, when we speak to her, we tell her, like, there's nothing that we could say to make it better.
Mm-hmm.
So just know that we're here for you if you need to talk about anything. We're here.
Nick, you're doing all the right things.
Absolutely.
Thank you for calling.
Thank you. I love your show, by the way.
Thank you very much. Number to call, 1-800-321-9755, 321-9755. Did you want to say something else, Dr. Cira?
Oh, no, I was just telling him good luck. I feel for him and his family.
Yeah, this is a difficult situation when people get in that. And it happens often when somebody is the caregiver and they've poured out their life and they feel like they could save somebody. They should save somebody, and they can't do it.
Right.
Frustrating. I've seen
Absolutely.
that. I've seen that in my own family when I was growing up as a kid with my grandmother.
I'm sure.
Yeah, it was very, very hard on my father. Yeah. Number to call, 1-800-321-9755. I want to remind you that our Community Connection, we have a great guest coming up at 1 o'clock, Sister Caroline Tweedy, who is the Executive Director of St. John's Bread and Life, which is the largest and I think most effective anti-poverty organization in New York City. And she will tell you about all the work that they do. It starts out with feeding people, but it doesn't end there because, as you've heard me say many, many times, the root cause of hunger is poverty, and the root cause of poverty is powerlessness. And what these people do is help people get power in their life and change their life. She's great. You'll hear from at 1 o'clock. Right now, though, we want to take your call at 1-800-321-9755. And it turns out that William, who got disconnected, is back again. William, what else did you want to say to Dr. Cira?
Oh, yes. So sorry for the disconnection there.
That's okay. Okay. Did you want to continue what you were saying before?
If I may. Yeah. So I'm currently, what I failed to say was I'm not longer working, and that affected that. And so getting back, just basically applying and all that, has been an issue also.
Oh, wait a minute. What happened to working?
So basically, I was working normal, and I started this whole new job, and it was going really, really well. And I had some issues with the manager, where the manager was super unfair towards me for just a couple of issues that had to do with things out of my power, and basically the person that was training me. And so it was a sales position, and so as I was definitely, on training and shadowing, they put me straight to just covering people that were going on vacation and so on. And so it just dragged into a point where I was put against the wall, and they make me responsible for certain things that were out of my reach and out of my hands.
And you hadn't been trained for, right?
And I was training for this. And so because I was still in training, there was nothing I can do. Basically, they could just fire you at will.
What kind of work was this, William?
Yeah, it was a food distribution company. Latin food. Basically, it's kind of like a certain brand.
Sure. How long have you been out of work?
So now it's been 6 months.
Okay. So I think, Dr. Cira, we're hearing another dimension of the depression here, because when you get out of work, you're going to easily fall into a deeper depression. And I suspect how are you living right now? How are you surviving?
So basically, I live with a brother, a family member,
and he's helping you out.
He's helping me out. He's lending a hand. And
okay.
And mind you, as the doctor was saying, I'm very friendly. I'm one of those people that I can make friends with anybody. I just don't see titles. I just start talking
Gotcha.
to you, and I'm
right,
super nice.
First thing I want to say before you go back to talk to Dr. Cira is that there are a lot of jobs out there now. And have you been looking? Have you gone to interviews?
So that's the thing. So I've gone through certain interviews. Nothing has panned out.
Mm-hmm.
My family is just saying just get whatever is out there and this and that, but I just don't want to get something that doesn't pay obviously pennies, and
sure.
And it's not that there's nothing honorable about any job. I'm not saying that. It's just basically that with my training, with my experience in the sales field and so on, I also don't want to waste my time and just go further down
sure.
the depression line.
One of the problems today, one of the problems today is that there's lots of jobs out there, but very few good jobs. And people, say, well, you have to start someplace. And I think that's kind of one of the bad situations that you're in right now. What else did you want to say to William, Doctor?
Well, William, you were starting to say something about your social. I felt like there was a but coming.
Oh no, I'm super social. I'm super friendly. People, for some reason, they feel very open to tell me stuff, to share stuff, but I draw a line when it comes to like following up. For example, if I was to talk to, let's say, a group of people and friends, and I become very friendly and they like me and this and that, but for me to then follow up and to actually arrange a meetup and do something, that is the struggle with me. Like just to get that drive to,
sure,
because I can meet you out on the street in the supermarket and start talking to you, and then but then after that, it's where it starts to get a little iffy.
Yeah, absolutely. I wonder though if there was somebody who could help you with that.
Yeah.
Who could pump you up and encourage you to do that follow up. I feel like it probably would be helpful for you because the depression makes you lose touch with who you are, right? When you see somebody in the supermarket and you get that experience of like, oh yeah, we're chatting and this is who I am, this is who I want to be. But then you go home and you're looking for jobs and you're not having luck and the depression takes over. That's where a social interaction can really, really help because it reminds you of who you are, who you want to be, that there's good stuff out there. I wonder if there's somebody in your life, maybe your brother or a friend who you don't have to necessarily follow up with. It's a very reciprocal relationship, who could encourage you in that area. What do you think?
So I'm very good with words, and so when they've been trying to help, I seem to always find a way to, because I don't want to hear the same kind of story, and I get frustrated with myself and my situation, and they try to help, and what they're doing is they're trying to stay on top of things. How are things going? Where have you applied? And this and that. But what I have failed to tell them is my depression. So they just see it as, I just lost my job, and what are you doing to get one back, and this and that. But I feel somewhat embarrassed, and I don't want to worry anybody in my family.
Well, but they are worried about you, and it may help if it depends on who you tell. But there may be somebody in your family that you can share this with. And let's go back to what Doctor was saying before about going for some therapy, because we've taken away the problem that you had that you think you're going to wind up having to take medication that you don't want. And she told you very clearly that that's not going to be necessarily the case. So see if you can find some sort of a therapist that you can get with Medicaid, and look around, because there are people available that are very, very good, but you're going to have to do something yourself to get connected.
Psychology.com, right? Is one
yeah,
website?
I thought that was a very good...
Psychology Today. Psychologytoday.com.
Okay.
Yeah, you can search by your zip code for providers who accept Medicaid. That's a great place to start. But William, I got to say, before you get off the phone, I'm hearing so much shame. I'm hearing so much shame about this, that
Yes.
you are feeling weak or broken or embarrassed, or that something is wrong with you because of this, and nothing is wrong with you. So many people suffer from depression. It's so incredibly common. We just don't talk about it that much. So I know it's not as easy as saying, don't feel ashamed about that. But really, I hope you can pull up my voice the next time that some piece of embarrassment or shame is getting in the way of you reaching out for help, for you going to psychologytoday.com or telling your brother what's going on. This is so common and normal, and nothing's wrong with you. You just need some extra support right now, you know?
Right. And I have no addictions. I don't like alcohol.
Good.
I don't
good.
like, my only addiction, if you will, would be food, or not like overeating, but like just going out and trying to be out there, and food is I guess the excuse to do it. But
that's okay.
But it's hard when you have a job.
Right, exactly.
Of
So
course.
I think Doctor's given you some very good suggestions here, and I hope you follow up on them. And
definitely. Is the doctor available also for like consultation? I can look into that with her as well, or not?
Well, I'm in Chicago, William.
That's the problem.
Got it.
Yeah, I'm not very local. Otherwise, I'd love to be able to help.
Right. But you can find somebody, you can find somebody. And one of the key things that the doctor said is so important for you, and that is to not feel shame. I mean, it's easier said than done, but there are millions and millions of people who suffer from depression of one kind or another, to one extent or another. And if you could share that with somebody in your family that say, hey, it's not just that I'm out of work, but I think I've got some depression here. And you got to talk to the right person, somebody who's not going to judge you and, tell you what to do, but just to be empathetic with you, to listen to you. I don't know if there's somebody like that in your family, but if there is, I think you ought to follow the doctor's suggestion on that. And thank you for calling, William.
No, thank you, and thank you for listening. It's very
good luck to you.
It's the first step.
Okay.
Yes, absolutely. Cheers to that.
All right, number to call, 1-800-321-9755. Let's talk to Dr. Peterson. Hi, this is Bill Ayers. You're on 95.5 PLJ.
Oh, my goodness, PLJ. Good morning.
Good morning.
Now, we're talking about depression.
Yep.
Now, yes, I'm Dr. Kevin George Peterson, and I have a couple of comments about some of the things I've heard and some things I've seen over the years. I've worked in the mental health field since the 80s, and we all have our own personal experiences with loss, depression, and it's not only with loved ones or ones that we may have cared about. I was very depressed when my cat passed away. The cat was 21 years old. And I was very depressed. I had to go through the loss process and things of that nature. Now, a lot of people may not understand depression. They just say something like, well, just shake it off or walk it off or, keep yourself busy or, do some. And if you, have ever experienced depression, it's really not that easy. I've heard a number of things that can be addressed in dealing with serious depression, and one is medication. Now, that's a risky road to go down, and it sometimes may be an easy Band-Aid, but not a cure for depression. I think depression has to be looked at in a number of different ways, and medication is one. there's sometime a need to speak to your doctor to say, here's what I'm feeling, here's what's going on, what would you suggest? And a lot of times there's adverse effects to some medications. You have to understand it, really read the material, really talk to whoever prescribed this, and let them know what you're going through. And is it really addressing the problem at all? So that is one avenue, and it should be looked at seriously. Another is, I hear, and I'm going to use this word, assumption. And I heard this a number of times throughout the show. Get with a family member. Is your family right? And this is an assumption that, and I learned this a long time ago, some people really do not have any biological family that they actually know.
That's true.
I worked in foster care for many years, and I know a lot of young people that I worked with, and when I worked in mental health, they really don't know. Do you have any sons, cousins, aunts, anybody you can, talk to about this? And some people really don't have any knowledge. I'm sure everybody has biological family somewhere, but nobody really knows where they are. They've never been connected. They don't know them.
Sure.
And family is a funny word. Support system was a big thing for me. And we used to do first family mapping. Who's in your corner? Who's really, really distant from you? And we would draw lines and say, well, I can count on this one. I can count on that one. This one I never speak to. This one I really don't like. And then you start to figure out, well, who can I actually call if I'm going through a depressed state or I'm suffering a loss? Who can I really speak to? And they do not have to be biological.
Absolutely.
To build a support team, it could be a therapist. It can be a pastor. It could be your neighbor. And start to figure out who can I really work with that I can talk to about I'm going through a rough time and I need someone to talk to.
Let's let Dr. Cira talk about this support team, the support assistance. That's something I know you work on as well.
Yeah, absolutely. I completely agree. And I'm sorry, are you a psychologist, a therapist?
I am a psychologist and I am a reverend. So I look at things from both science and divinity. So I look at things from different ways, and both of those avenues can give people support.
Absolutely.
Absolutely. And family, right. I love that family doesn't have to be biological, right? It is a sensitive word, and so I appreciate you pointing that out. But what we know is most important through research is how somebody perceives the level of support they have. And if someone perceives that they have a high level of support, even if they're not talking to people all of the time, those folks are going to be more resilient than folks who perceive themselves as having a very low level of support. So absolutely, all of your points are very well received.
I believe also, I hope I didn't cut you off, but I believe also that as a professional, if someone comes to me and they say, well, this is the pinpoint, this is the point of why I'm depressed or why I'm grieving or this is my loss or this is why I feel depressed, I say, okay, we can start from that point and I may delve a little deeper and look into it and say, you know what, there's a couple of things that are going on here, just not the one point where you said, I lost my cat, my dog, my mother, my father, my best friend. But I think, how long has this been going on? And some people have some pathological depression, A, and B, a need for attention. I get all this attention because, not to try to downsize this, but, boo-hoo me. Can somebody come and nurture me? Can somebody hug me? Can somebody bring flowers? This may have been going on for some time, and it may not have to do with the one point that they introduced to me or to a professional, but this may have been going on. I may say, you have to go if you are grieving or if you are depressed, then it may be a clinical depression or something of that nature. Maybe as some of my individual patients, you need attention. So let's figure out healthy ways for you to
Good
get
point.
the attention
Good
that you
point.
may need.
Good point. Getting healthy attention.
Healthy attention. And there's wonderful groups, community centers. I had one client, and I said, well, what are you doing? You know, and someone said that on the show. They said, what are you doing? You know, you want to be the recipient of everybody to come to care for you, but what are you actively doing to deal with what you are saying is a depressed state? Say, well, I'm going to group. I'm doing this. I had a wonderful patient. I said, well, what are you doing? She said, well, I'm an AA, which is a wonderful 12-step program, NA, another wonderful 12-step program, OA. I said, but you're not fat. Is there somebody? But she would go to all of these groups, not having really any of the problems that the group was listed for, but she would get all this sort of attention and all these phone numbers, dial them, don't file them. But she was happy after that because she would go to meeting after meeting after meeting, get all this attention.
Good for her.
But
Doctor,
that's what she needed, and that's what she did. She took care of it.
Doctor, I want to thank you for being part of the show tonight. We appreciate your comments and your expertise. And thank you for calling.
Wonderful show. Keep doing what you're doing. It's a great service to a lot of people that need to hear your message.
Thank you. Thank you. Thank you very much. So I just wanted to ask you, Dr. Cira, if there was any other one thing that you'd like to say before we have to leave in a couple of minutes, anything that we've missed that you think is crucial for dealing with depression?
Well, you know what? I think one of the things that the therapist who just called in talked about was assumptions. And I think one of a big assumption that people make about therapists is that we don't struggle.
Good point.
We've got this all figured out, and which just couldn't be farther from the truth, right?
Yes.
And so I feel like some of the best therapists, I certainly feel like the reason that I have the competence that I do is because of my own struggles. And so I just want to put it out there for anyone listening who might be making assumptions about my life or anything like that I have struggled too. I've gone through tremendous stressors, traumas. I've survived major depressive disorder as well. So my life has not been picture perfect or easy. I don't have it all figured out. It's not that I don't have struggles. I'm just able to see other people's struggles because I'm climbing my own mountain and watching other people climb theirs, right? So I have all this distance, and that distance offers me perspective that for the people actually on the mountain, and it's in their nose, that they simply can't have. So wanting to put that out there for anyone who's feeling like,
very important. Yeah.
Good. I think that is important.
Therapists are not perfect, and you need to have one that has empathy, like the doctor that we're talking to and the gentleman who just called before. People have empathy who can have a sense of understanding and a willingness to listen and recognize that these are very difficult problems, and it's a journey. That's one of my favorite words. I always talk about us always being on a journey, and it's a journey into the mystery, and we need help often to deal with it. I want to thank Dr. Cira for being with us tonight. She is a clinical psychologist, and she runs something called the Cira Center for Behavioral Health out in Chicago. Thank you for being with us.
Thank you so much for having me. Best of luck to anyone who's listening and struggling.